What's the biggest bullshit biohack? Like, what's the thing that you roll your eyes at every time you see people promoting it?
Boy, there's so many.
All right, give us 10.
So I think a lot of the sort of stem cell stuff is pretty freaking dangerous. I think that there are probably instances in which stem cells could be really helpful. I think if you tore a muscle, if you tore your rotator cuff or something, I would love to see a study where we looked at non-operative management, so just sort of PT rehab versus PT rehab plus stem cell injection. Would there be a difference? The answer is maybe, right? But when you look at sort of the grotesque misuse of this stuff in areas where it's just clearly not going to play a role, for example, the intravenous administration of this stuff or the intrathecal administration of this stuff. I mean,
what's intrathecal?
Intrathecal, like into the spinal cord and stuff like that. I mean, there's just no plausible mechanism by which you're going to inject stem cells into somebody's bloodstream that they're not going to get, completely torn up by the cells in the lung. And at the best case scenario is it does nothing, but the worst case scenario is, you've wasted a ton of money and you've potentially, subjected yourself to some infection or something like that. And we don't hear enough of those stories. I do hear some of those stories of the people who get horrible infections when they go down to, Costa Rica or Colombia to get their stem cell treatments, which says nothing of how much money is being spent on this sort of thing. So my guess is there's some signal there, but it's like most of what you're seeing is not.
This is a huge industry.
Yeah, it's actually kind of remarkable that it exists. But I mean, I shouldn't say that. Anytime you can do something to convince people without data that something works, it's a win-win, right?
I'm just so shocked that it's become so normalized. I haven't heard really any pushback about it outside of you. Now, I haven't done much research, and again, I'm like completely ignorant to all this stuff. But wow, so the stem cells, you see marginal benefit potentially, and no real data to back it?
Definitely no data. So people that talk about data are talking about anecdotal data. Like, my cousin Joey, I mean, he had stem cells and he's 100% better. It's like, okay, well, I mean, again, maybe Joey would have got better anyway because, so you cannot study these things without blinding. And without randomization, you simply can't.
And who's signing up for the blind stem cell study?
Right.
If you got enough money to get your shoulder fixed and you're willing to go to fucking Colombia to do it, then you want the real stuff.
Yeah.
Are there other?
Yeah, I think a lot of the peptide stuff is total nonsense.
BPC 157.
Yeah, so let's take that one. It's the most popular.
What is it?
So BPC 157 is an analog of something called vascular endothelial growth factor, VEGF. So what is VEGF? So VEGF is a molecule in the body that promotes something called angiogenesis, which is the creation of new blood vessels. So angiogenesis is really important in certain processes. In fact, it's important for cancer, right? So cancer has to utilize VEGF to
grow and
spread and grow.
Yeah.
So many years ago, a drug called Avastin was introduced that was an anti-VEGF drug.
To limit the growth of cancer.
Target this thing, right? Okay. So, but there are clearly times when you would want lots of angiogenesis, when you want proliferation of blood vessels. And so the thinking is that if we give people BPC 157 and they have an injury, maybe it improves healing. And I think it's possible, but there were a couple of challenges with this, right? So you can take BPC 157 orally, but the bioavailability is only 10 to 20% because the acid in the stomach tends to rip peptides apart. So it's not clear that you can take enough of this stuff by mouth to actually meaningfully get it into your body. Furthermore, how much would you need to take? Like, let's say your patella tendon is the thing that's flared up and you really just want to get, more blood flow there. Should you just be injecting BPC 157 there? The half-life of it is like 1 to 2 hours. So then the question becomes like, how often do you have to use this stuff? I mean, you need to be injecting it 3 times a day. And again, without any data, we just don't know. So I think there's biological plausibility to it, but if that weren't enough, the FDA has cracked down on these things and said, like, come on, guys, we need to see some data if we're going to let you use these things. So now pharmacies can't make this stuff anymore. So now when people buy peptides, they have to do it in a very shady way, which is they have to buy it from a manufacturer who claims that they're only selling it for research purposes and that you're only buying it for research purposes. And then until they get shut down, and then it's like a kind of a game of whack-a-mole, but there's no quality control. And truthfully, like, I would really like to see this studied so that we could know. Like, I'd like to see what's called an IND, which is, means like the FDA stamps this with an investigational new drug status and let it get studied, and let's decide once and for all, like, does this work? Because I'm sure there's going to be a time in my life when I'm going to want every trick up the sleeve that could be used to address these things. There are some peptides that actually, I will say, completely do work. They're biologically identical to certain hormones in the body. So Samorelin, for example, is basically a growth hormone analog. It works perfectly well. But then you have to ask the question, what are the pros and cons of taking growth hormone?
Yeah.
Yeah, what is I know many people that when they hit 35, 40, their testosterone goes down and doing, TRT and growth hormone stuff to get it back to that baseline level.
Yeah.
What are your thoughts on that?
I mean, totally different things. I would say when it comes to TRT, I think the data are really good at the benefits of TRT in a low T state. Obviously, you have to be aware of certain situations, like, if you want to have kids, TRT, you have to be, I wouldn't recommend TRT to somebody who still wants to maintain fertility. I would recommend HCG, which is another way to increase testosterone production without giving testosterone and shutting down endogenous production, the body's production. Growth hormones is a more complicated one, and I'm still of two minds on this, which is on the one hand, there's really no data one way or the other saying it's good or bad, right? Actually, that's not true. There are data saying it's good in certain cases, like HIV wasting, right? So people, like back in the 80s when we didn't have highly active antiretroviral therapy for patients with AIDS, you had nothing to offer these people but like high doses of steroids and growth hormone. And by the way, dramatically improve their quality of life. So we know that at least in the case of AIDS wasting, growth hormone was amazing. I've never met a person who took growth hormone who didn't say they felt better. So the question is, at what cost? I've never taken it, but I tell you, I'm sure at some point I'm probably going to be like, you know what?
Let's try it.
I don't care about the risks anymore. I'm old enough.
Yeah.
I feel crappy enough. It's time to start taking it. But, I'm only 52. I'm gonna hold out a little bit longer before experimenting.
Right.
What about like NAD or all these like cosmetic IV drips?
Yeah. NAD is another one where there's a great argument for why you would take it, because NAD levels decline as we age, and NAD is very important. So that if you took those two, if I told you there's this really important thing in your body and it gets lower with age, the obvious answer is I should be taking more of it. Okay, totally get that. So then the question becomes, how do you take it? So there's basically two ways you can take NAD. You can take it in an intravenous infusion. I think that's a total waste of time because, one, they're giving you probably way more than you need. And how often can you do that? Like, even if you were the most committed junkie, like, would you do that once a week? Right. That's not going to create the half-life of NAD is quite short. That's not going to meaningfully contribute to your total body levels of NAD. So people then try these. And the other way you can take NAD is through formulations that you take under the tongue so that they get absorbed in your lymphatic system. That might be more promising. I'm kind of interested to see how that pans out. And then there are people that take these NAD precursors. One of them is called NR, and one of them is called NMN, which you've probably heard of. And, frankly, there's no evidence that those get turned into NAD in meaningful enough quantities. They do a little bit, but they don't seem to get turned into it enough to really matter. And also, all of the clinical trials, and I say clinical trials kind of in quotes because they're usually industry-funded trials, but all of these experiments, they don't tend to show very interesting outcomes except in very esoteric cases. So there was probably the best study that people point to. The two best studies that people point to, one is in people with Lou Gehrig's disease. I think they were given NR, And the people that were given NR had a slightly longer time till they needed to go on a ventilator. And I mean, that I don't know how clinically relevant it was, but to somehow suggest from that outcome that like we should all be taking NR is a huge stretch.